Welcome back and watching In Focus. Now, in sub-Saharan Africa, a woman's lifetime chance of dying as a result of childbirth is 1 in 42. Compare that to Europe, where the rate is about 1 in 33,000. Our health correspondent Linord Moudou is here with more. Linord.
Hello, Vincent. Well, in 2000, the United Nations member states agreed to try to reduce extreme poverty in its many different forms globally. This translated in the 8th Millennium Development Goals to be achieved by the year 2015. Goal 4 and 5 focus respectively on the reduction of child mortality and the improvement of maternal health. More than 50% of maternal deaths worldwide occur among women in Africa. With only 1,000 days left to achieve the goals, analysts say addressing child and maternal death must be made a top priority in Africa. The United Nations Population Fund, UNFPA, along with the African Union, is addressing the issue through the Campaign for Accelerated Reduction of Maternal Mortality in Africa, or CARMA. To discuss this further, it is my pleasure to welcome from our New York studio Dr. Babatunde Osotimehin, Executive Director of the United Nations Population Fund. Dr. Osotimehin, welcome to the program.
Thank you very much.
Now, as we mentioned earlier, 50% of maternal deaths occur in sub-Saharan Africa. However, some statistics show some improvement. How would you assess the general state of maternal health in Africa?
I think when you take it on a country-by-country basis, we have some countries that are doing extremely well. And we've been able to reduce maternal death in those countries. Countries like Rwanda, Ethiopia is doing well. And we also see signs of change in countries like Nigeria. And I think what needs to be done, which is why the United Nations Population Fund, UNFPA, and the African Union Commission decided to reinvigorate the campaign to accelerate the reduction of maternal mortality in Africa, which was launched in 2009.
In 2009, and what are the main aspects of this campaign, actually?
The campaign is to make sure that we can provide for every woman who is pregnant and requires services, the services that she requires to deliver safely. Now that involves antenatal care. It involves to be attended at birth by a skilled birth attendant, and making sure that the child is safe when it's born. Now, of course, there are issues along the line which we have to address. The first is the issue of health. Health workers. In many parts of Africa, we don't have the number of health workers that we require to achieve this objective. And then the other part is making sure that you can get commodities to the point of service. And this requires a lot of investment by African governments to ensure that this happens. Now, what we are doing now with CARMA, which we've done with the African Union, is to try to reinvigorate this, make sure that African governments commit to building health services, making sure that there are more health workers, making sure that commodities get to where they're expected to get to.
And what type of commitment have you seen from the governments?
A lot of commitments. And now, before I get to those commitments, making sure that every woman who requires family planning gets it when she needs it. 222 million women in the world require family planning. They're not getting it. Most of them are in sub-Saharan Africa. The commitments we see is, for an example, we had an event in Addis Ababa in January where we tried to reinvigorate this, and 51 countries were present, 32 at the levels of heads of states. And they have now gone to the assembly itself to reaffirm their commitment to making sure that we can work on the ground with their ministries of health to accelerate the reduction of maternal mortality. So I think we're beginning to see this. We're also beginning to see more investments by governments themselves into these issues. For instance, July last year, we had an event in London for family planning. Many African governments were there. I was very proud to see that 3 African heads of states were present, and they increased their investments in maternal health, particularly in family planning. So we see rays of hope coming out of Africa in terms of trying to address this.
And Dr. Osotimehin, we know that in many settings, men play an important role in women's health. How do we ensure that they are part of the solution? Is CARMA addressing this?
Yes, CARMA addresses it, and we at UNFPA also address it. We, for an example, set up in Niger Republic what we call husband schools, and we try to get men, from all walks of life, government, civil society, the private sector, and the faith-based organizations, to talk to them about what needs to happen to women so that they can access services, they can get family planning, they can also be looked after when they're pregnant.
Okay.
And we've succeeded. In a short period of 5 years, we have increased uptake of family planning from 5% to 20%.
And in 5 seconds, are you optimistic then with regards to the MDG 5 by 2015?
Well, we have 1,000 days to go. I'm optimistic that we can increase the uptake of services by women who require it. Now, on a country-by-country basis, I guess that we will make progress. Okay. Where we would attain it, it depends on how much progress in each country.
Dr. Osotimehin, thank you so much for joining us today.
Thank you very much.
And that's our Africa Health Network report for today. For more health news and developments, be sure to visit our website, africahealthnetwork.com.